यार इफ़ यू गोइंग टू द एयरवे वर्कशॉप, तो उसमें बेसिकली तुम्हारे पास दो अप्रोच है। या तो तुम वर्कशॉप अटेंड करो पहले और फिर उसके बाद पोस्ट वर्कशॉप जाके उस टॉपिक्स के बारे में पढ़ो, या फिर ऑब्वियसली पहले पढ़ के जाओ फिर वर्कशॉप अटेंड करो एंड देन वापस आके जो कमियां बची वो दोबारा पढ़ो, विच इज़ ऑब्वियसली अ बेटर वे। अब इफ़ यू हैव सम आइडिया, तो तुमको पहले से पता होगा कि ये टॉपिक्स कवर हो रहे हैं, तो थोड़ा सा उनके बारे में देख के जाओ। पिछली एयरवे वर्कशॉप्स में बेसिकली कुछ लेक्चर्स होते हैं जो पावर पॉइंट प्रेजेंटेशंस होती हैं, तो उसमें एंडोट्रेकियल ट्यूब वो कवर करता है। एंड ऑब्वियसली इसमें पीडियाट्रिक वर्सेस अडल्ट ही बताते हैं। और उस पीडियाट्रिक में कि बहुत सारी ट्यूब्स हैं, जैसे कॉल्स ट्यूब होती है इमरजेंसी में लिए, या फिर जो स्कोप होते हैं हमारे लैरिंगोस्कोप होते हैं, उसमें मिलर वर्सेस मैकिन्टॉश है, तो मिलर किस में यूज़ करते हैं। फिर वो जो एंडोट्रेकियल ट्यूब है उसकी और क्या चीज़ें होंगी उसमें, कॉल ट्यूब है, लेंथ या ये डेप्थ ऑफ इंसर्शन हमारी, कि कितने वीकर अगर हमारा बच्चा है तो उसमें व्हाट विल बी द लेंथ ऑफ और द डेप्थ ऑफ इंसर्शन, साइजेस ऑफ एंडोट्रेकियल ट्यूब। ठीक है, जो बेसिक हम कभी भी किसी एंडोट्रेकियल ट्यूब लेक्चर में देखते हैं कि ट्यूब मार्किंग्स क्या है, मटेरियल क्या है, कफ इन्फ्लेशन सिस्टम, रेड रबर ट्यूब के बारे में, फ्लेक्सोमेटालिक वर्सेस नॉर्मल ट्यूब, व्हाट इज़ द कर्व ऑफ एंडोट्रेकियल ट्यूब, मर्फी आई, Meggles type में there is no Murphy eye, the bevel angle. So basically it is about the basic of endotracheal tube and then उसके कुछ pediatric variations. ये सेम चीज़ जो लेक्चर होगा, there will be a demonstration और a workstation for the same. तो वहाँ पर मैनिक्विन पे there will be simulation for the same. इस सिमुलेशन में ही obviously which is related to the lecture, इस सिमुलेशन में they will try to give some case scenarios. अब case scenarios most important will be कि तुमने एंडोट्रेकियल ट्यूब डाली, तो उसके बाद what will be differential diagnosis for desaturation. नॉट श्योर कि इस वर्कशॉप में होगा नहीं होगा, बट दिस इज़ समथिंग दैट यू शुड रिमेंबर कि तुमने ट्यूब डाली है जस्ट अभी एंड द पेशेंट इज़ गेटिंग डिसैचुरेटेड और देयर इज़ सम डिक्रीज्ड एयर एंट्री और एब्सेंट एयर एंट्री, तो यू हैव टू नो अबाउट द डिफरेंशियल डायग्नोसिस, वेदर इट इज़ एंडोब्रोंकियल और देयर इज़ सम न्यूमोथोरैक्स, right? Or if there is some this SpO2 probe is itself creating problem, you have to just rule out what is the cause for that desaturation. This is one of the case scenarios, and most important to rule out will be laryngospasm and bronchospasm. Obviously you know that laryngospasm is present after you have extubated and the tubes and the vocal cords have got adducted, but in bronchospasm this may be present in an intubated or a non-intubated patient. They have to rule out these things. This will be the association of the first endotracheal lecture with the workstation. Then there are lectures related to supraglottic airway devices. The benefit of this workshop will be that you will be able to see those rare LMAs such as Supreme. You will be able to see they had air track also last time. Then iGel, the variation of iGel, which is iGel O2 now, and some other intubating LMAs. And this was one of the workstation when you will be intubating through the LMA. Now intubating through the LMA is usually fiber optic, which is gold standard is fiber optic guided. So they are going to teach you on a pediatric mannequin how to intubate, first how to put a LMA, various methods of putting LMA. Then once you have put the LMA, then you will be putting your fiber optic and then through fiber optic guidance you will be intubating the patient. This is one of the workstation again related to the supraglottic device. Then the third station or third lecture maybe for the fiber optic, for the pediatric fiber optic. So there are various sizes of pediatric. These fiber optics are usually fiberless, so you can actually bend them in whatever shape and direction you want to, unlike the normal fiber optic that we use in our OTs. So this is one good opportunity to see this fiberless fiber optics there. Then you will be having lectures on airway ultrasound. This is something in primitive stages. People are still doing studies, none of them are too reliable, they are very less meta analysis. So airway ultrasound is one additional thing which you usually see only in workshops or people doing thesis. You don't have to worry if you're not able to comprehend exactly what that is, but at least which type of probe to use. They are like hockey stick probe is the best for pediatric. Then we have linear probe or the curvilinear probe. So you will get some volunteers, and on those volunteers you can perform the airway ultrasound to at least discernate the anatomy of the thyroid cartilage or the thyroid gland. I'll show you what structures they usually show. They show you these structures: mentum, tongue with the muscles, palate, hyoid, pre-epiglottic space, epiglottis, thyroid, cartilage, vocal cord, cricothyroid membrane. Very important for your emergency airway. Cricoid cartilage, then tracheal cartilage. Then these are the certain the uses of airway ultrasound to differentiate the laryngomalacia and the vocal cord palsy, confirmation of endotracheal tube of placement, whether it is esophageal or normal, and measuring the size of the tube, which size of the tube will go inside, because the formulas are not always reliable. So you can measure the diameter of the airway and then choose the size of the tube. Then the front of neck axis, you have to identify the cricothyroid membrane. Then in the parasagittal view, we will be having pearls of string appearance like this, where you have the cricoid cartilage, the thyroid above, cricothyroid membrane, tracheal rings. The esophageal intubation will get a double track sign. So you can study about the double track sign and pearls on string appearance beforehand, before the workshop, so you can able to see them there come quite easily. Then to see the tip of the endotracheal tube, you have to measure the distance from the aortic arch and the tip of the endotracheal tube. So these are the additional things which you see in the airway ultrasound workshop.